Gastroparesis is a condition where your stomach has trouble emptying food properly. Think of your stomach as a natural blender and pump combined, so it needs to both break down your food and push it along into your small intestine. In gastroparesis, the pumping action, also called motility, slows down or stops working effectively. This means food stays in your stomach much longer than it should, leading to various uncomfortable symptoms and nutritional challenges. To understand this better, you need to know how a healthy stomach typically works. When you eat, your stomach muscles contract in a coordinated way to crush food and mix it with digestive juices. These contractions then push the processed food into your small intestine. This process is controlled by your vagus nerve, which acts like an electrical system telling your stomach muscles when and how to move. In gastroparesis, this system isn't working properly, so food moves through your stomach much more slowly than the normal 2 to 4 hours it should take. Types of gastroparesis. Gastroparesis can be categorized in several ways, primarily based on what causes it. Number 1. Idiopathic gastroparesis. This is the most common form. Idiopathic means that the cause isn't known. Many people develop gastroparesis without any clear trigger. Number 2. Diabetic gastroparesis. This type occurs in people with diabetes due to vagus nerve damage from long-term high blood sugar levels. This is also one of the most common forms. Number 3. Post-surgical gastroparesis. This type can develop after surgery involving the stomach or vagus nerve. Number 4. Medication-induced gastroparesis. Certain medications such as opioids or drugs that slow down gut motility can contribute to the development of gastroparesis. Causes of gastroparesis. The development of gastroparesis can be traced to several different causes. Number 1. Diabetes. Both type 1 and type 2 diabetes can damage the vagus nerve, which is crucial for coordinating stomach muscle contractions. Number 2. Surgical complications. Certain surgeries, especially those involving the stomach or esophagus, can inadvertently damage the vagus nerve. Number 3. Medications. Some medications, particularly certain antidepressants, anticholinergics, and pain medications, can slow stomach emptying. Number 4. Viral infections. Some people develop gastroparesis after a viral infection that affects the stomach. Number 5. Neurological conditions. Conditions like Parkinson's disease or multiple sclerosis can affect nerve function and lead to gastroparesis. Number 6. Autoimmune conditions. Sometimes the immune system attacks the nerves controlling stomach motility. Symptoms of gastroparesis. Living with gastroparesis can be challenging, as the symptoms can significantly impact your daily life. The most common symptom is feeling full very quickly when eating, even if you've only had a few bites. This isn't just the normal fullness you feel after a big meal. It's an uncomfortable, sometimes painful sensation that can last for hours. Many people describe it as feeling like they've eaten a huge Thanksgiving dinner after just a few spoonfuls of food. Nausea is another common symptom, often occurring throughout the day, but particularly after eating. This nausea can be persistent and severe, sometimes leading to vomiting. Some people find themselves vomiting undigested food several hours after eating, which can be particularly distressing. Acid reflux and heartburn also frequently occur, because food sitting in the stomach for too long can push stomach acid up into the esophagus. This creates a burning sensation in the chest and throat, often worse when lying down. In addition, some individuals experience pain or cramping in the upper abdomen, often described as a dull ache or sharp discomfort. This pain might worsen after eating and can last for hours. Other than that, weight loss often follows because eating becomes such a challenge. Some people develop anxiety around meals because they know eating will trigger their symptoms. Others struggle with maintaining proper nutrition because they can't eat enough or keep food down. Diagnosis of gastroparesis. Getting diagnosed with gastroparesis typically involves several steps and tests. Your doctor will start with a detailed medical history and physical examination, particularly focusing on your digestive symptoms and any conditions that might cause gastroparesis. The gold standard for diagnosis is a test called a gastric emptying study. This involves eating a meal containing a small amount of radioactive material, which is safe, and then having several scans over 4 hours to see how quickly your stomach empties. This test gives doctors a clear picture of how severely your stomach motility is affected. If food remains in the stomach longer than expected, gastroparesis may be diagnosed. Endoscopy is another useful tool, allowing doctors to examine the stomach lining and rule out other causes of symptoms, such as ulcers or blockages. In some cases, a barium swallow test may be conducted, where you drink a liquid containing barium, which helps outline the stomach and digestive tract on x-rays. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for gastroparesis. Unfortunately, there is no definitive cure for gastroparesis. However, several treatments can significantly improve symptoms and quality of life. Number 1. Dietary modifications. The way you eat becomes crucial in managing gastroparesis. Eating smaller, more frequent meals can reduce the workload on your stomach, making it easier to digest food. Think of eating 6 to 8 small meals throughout the day rather than 3 big ones. Also, go for low-fat and low-fiber foods, as these are easier to process. Avoid carbonated drinks, as they can increase bloating and discomfort. Pureed or liquid meals may also be helpful for severe symptoms, as they are less taxing on the digestive system. Number 2. Medications. Several medications can help manage the symptoms of gastroparesis. Prokinetic drugs like metoclopramide or domperidone can improve stomach motility, helping food move more efficiently through the digestive tract. Antiemetic medications such as ondansetron can also relieve nausea and vomiting. It's essential to work closely with your doctor to monitor the effectiveness and potential side effects of these medications. Number 3. Blood sugar management. For individuals with diabetic gastroparesis, maintaining stable blood sugar levels is crucial. High blood sugar can further damage nerves and worsen gastroparesis symptoms. Number 4. Hydration. Staying hydrated is critical, especially if vomiting is frequent. Sipping clear fluids like water, broth, or electrolyte-rich drinks can prevent dehydration. Number 5. Surgical options. In severe cases of gastroparesis, where symptoms cannot be managed with dietary changes or medications, surgical treatments may be considered. Here are the most common surgeries. Number 1. Gastric electrical stimulation. This involves the implantation of a small device, often referred to as a gastric pacemaker, under the skin in the abdomen. This device delivers mild electrical pulses to the stomach muscles through implanted leads. The electrical stimulation helps regulate the contractions of the stomach, promoting better movement of food into the small intestine. GES is particularly effective at reducing symptoms like chronic nausea and vomiting, though it may not significantly speed up gastric emptying in all cases. Number 2. Pyloroplasty. Pyloroplasty is a surgical procedure that widens the pylorus, which is the opening at the lower end of the stomach that connects to the small intestine. In gastroparesis, this area can become narrowed or spasm, contributing to delayed stomach emptying. By surgically enlarging the pylorus, food can pass more easily from the stomach into the intestines. The procedure is often done laparoscopically, meaning it involves small incisions and minimal recovery time compared to traditional open surgery. Number 3. Gastric bypass. This procedure involves creating a new connection between the stomach and the jejunum, which is a part of the small intestine. This bypasses the non-functioning portion of the stomach. By doing this, food moves directly into the small intestine, alleviating symptoms of nausea, vomiting, and bloating caused by food sitting in the stomach for too long. While effective, this is a more invasive procedure and comes with risks such as infection, leakage, or nutritional deficiencies. It is typically reserved for cases where other treatments have failed and the patient's quality of life is severely impacted. Now, we want to hear from you. Have you or someone you know experienced gastroparesis? What strategies or treatments have helped manage the symptoms effectively? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.